This is Dr. Corey Maas on Looking Your Best. I'm talking a little bit about Clear and Brilliant today. And basically, when we talk about these technologies, we're talking about ablative or non-ablative laser skin resurfacing. And so these two categories are very important when we talk about ways of treating the skin to improve the aging signs, improve the tone, the texture of the skin, and most importantly, when we talk about non-ablative laser in the area of Permea, this is a treatment specifically for unwanted skin pigmentation changes such as melasma, post-inflammatory hyperpigmentation or PIH, and just general lentigines or sun damage. All of these are really part of a program to improve the skin quality and really make our skin change from the damage it's received from years of sun exposure. Whether you're younger or older, there's always sun exposure. We have some, obviously more than others. More or less, we all have some sun damage. And most importantly, we can retard the progress of intrinsic skin aging by doing certain things, maintaining your skin with a good program of skincare. And there's 4 basic parts to it, in my opinion. Exfoliating gently, that can be done at home with a buff puff. Using a retinoid, in particular tretinoin, which is the best molecule in different strengths. L-ascorbic acid or vitamin C cream, moisturizing, and you don't have to spend a fortune on moisturizers. And there's a number of different products that we recommend and use that have combinations of these products in there as we're discussing. And then we get into treatments. There's certainly things like intense pulse light therapy, which we can talk about later. And then fractional and non-fractional, or fractional ablative and non-ablative resurfacing are really the key parts to resurfacing. Non-fractional or full ablative laser resurfacing is something I don't do much of anymore because of the significant recovery when you do full ablative laser resurfacing. Tremendous results, yes, but longer recovery times that are significant for most people. It's dramatic swelling when you do full face. Full ablative resurfacing. Fractional laser lays little tiny dots, as you'll see in a little video that I have in a moment, of laser energy down. In the case of non-ablative fractional laser, there's minimal or only very modest skin surface injury, whereas when we do fractional ablative, there is more surface skin injury, but this is really stimulating the wound care and healing process. So when we look at these treatments, there are a number of different devices that are available for use. Basically, we are using a relatively simple one that has a very easy to use guidance and handpiece. The little light illuminates when we're going at the right speed with this particular device, and that really helps our users to do the best job in terms of laying the laser energy down, providing the best opportunity for really good results. And I think that's super important, is that we get the best results that we can when we're using these technologies. We can use it on any sun damaged area, the face obviously included, but it also includes other areas of the body as a non-ablative or minimally ablative type of laser, which is laying tiny little dots, microscopic in fact, dots of thermal energy to the skin surface, and really creating, most importantly, targeting the chromophores, the colors underneath the skin, and stimulating a wound healing and remodeling process. With Clear and Brilliant, there's virtually no downtime to this treatment. The only thing is that patients must not use aggressive skincare right away. With the Permea, there's a little bit more surface damage, which allows us to use our topical ointments, creams, or other types of treatments which can help downregulate melanocytes and in particular improve unwanted pigmentation, such as we see with melasma or post-inflammatory hyperpigmentation. And this is called the Clear and Brilliant Permea when we describe that. So the device is simple to use and really simple for patients to recover from, which I think is an important addition to what we provide in terms of opportunities if people aren't ready for fully ablative fractional or non-ablative resurfacing. Non-ablative resurfacing being the Permea or the Clear and Brilliant, and you can see that patient satisfaction rates in the study on 5-point scales are quite high for these various appearance-related skin changes or improvements that we see with uniform tone, smoothness, and texture. And with Permea, if we add that, we'll see improvement in the pigmentation. These examples with just one treatment for patients that have a lot of skin surface irregularities, pore size changes, and in particular, as you can see in these patients, perioral around the mouth, hyperpigmentation. This is typically post-inflammatory in patients that have done waxing. And really after a single treatment, you can imagine if there are more than one, just improved skin tone and quality overall. So in summary, Clear and Brilliant, and in particular Permea, are treatments that are non-ablative, fractional, or minimally invasive, often called microfractional laser resurfacing. The Permea is specifically designed to target the deeper pigments in the skin. They are used, once the treatment is done, we use our skincare products, which the conduits are created for the delivery of the down regulators of melanocytes, the things that actually treat the pigment producing cells and get them to stop working so hard, which is great for treatments for melasma, post-inflammatory hyperpigmentation, and even lentigines. If you have any questions about Permea, Clear and Brilliant, or other treatments that are fractional ablative, fractional non-ablative, or full laser resurfacing, or skin resurfacing in general, please don't hesitate to call or write at drmaas.com. This is Dr. Corey Maas on Looking Your Best.